Joining us now to break down these concerns is Dr. Amit Arya. Doctor, the Ford government says these surgeries and procedures will be free, but can you foresee some hidden costs that Ontarians might be subjected to?
Yeah, absolutely. I think that's a great question. And in order to answer that question appropriately, it is important that we get a little bit into the nitty gritty about what is actually in the details behind this announcement. So, generally, when we talk about privatization, we are talking about two different types of privatization. And often, when people think of privatization, initially they think about what we call private pay, where you would have to pay to access healthcare. And what the premier is saying is that you won't have to pay; it will be covered by your health card. But where the problem arises is who is delivering the healthcare. So in this case, what the government seems to be proposing is that they would expand for-profit corporations who are beholden to shareholders or investors delivering healthcare, and that is absolutely a concern because in for-profit facilities, for example, those that provide surgeries, by their very definition, they want to generate profit and they are not focused on the quality of care. We have decades of evidence and data which actually shows us that there are poorer patient outcomes when they're delivered by a for-profit entity, sometimes even preventable mortality. And here in Ontario, we have a lot of examples of upselling where patients are pressured into purchasing non-insured or unnecessary services and are sometimes even told that those services are mandatory in order for them to receive care.
There were also concerns about the move to private clinics taking away staff from public hospitals. Can you explain how that might be?
Yeah, so that's probably the biggest concern with this announcement. Right now we have a very limited and, perhaps even a shrinking pool, of staff. And in particular, when we're speaking about staff, I'm referring to nurses. So Ontario went into the pandemic with a dire shortage of nurses. Actually, we have the lowest amount of nurses per capita, compared to any other province in Canada. Our pool of nurses has shrunk due to multiple factors: burnout from the pandemic, working short-staffed, of course, is a vicious cycle in itself, where you have to take on more and more work. And then, of course, Bill 124, which has led to wage suppression of nurses and effectively led to a pay cut when we factor in, the increasing cost of living. So with that, the big worry is that if you're burnt out working on the front lines in an emergency department or in an OR as a nurse, you're affected by Bill 124. Now you would have more of an option to leave to work in a private for-profit surgical clinic where, actually they cherry pick patients. And what that means is that they select patients who are easier and are not as complex. You don't have to work after hours. You don't have to do call. So you're not working evenings, weekends, or overnight, and you really have an 8-to-4 job.
Why do you think it's so important to keep healthcare in Ontario away from private clinics or privatization in general?
I think, once again, there's a lot of data and evidence which shows us that, once again, when care is provided by for-profit entities, outcomes for patients are worse, the quality of care is worse, and costs for the taxpayer are actually increased. So really, for-profit delivery of healthcare does not perform better on any single metric of care. And once again, we have to think about where the profit is coming from if you're running a for-profit operation such as this. So it can only come through either charging the patients or pressuring the patients to pay for unnecessary services, billing the government for more, or trying to run a more leaner operation where you're cutting back on staff and trying to cut back on costs because you are beholden to shareholders or investors.
Thanks so much for joining us, Dr. Amit Arya.
Thank you so much.